So I'm calling this health profession education for a particular reason, not just medical education research. There are many journals that actually are focused on health profession education. Now that we have this brave new world of interprofessional education, there's opportunities for health profession education, and my faculty in nursing don't want to come to meetings that are talking about medical education research, so we call it health profession. Also, when you are publishing, you want you want to cite literature that's not just medical education literature. Academic medicine specifically says in its review criteria that it does not accept papers that only cite medical education. They want to see that people are more broad. That can be nursing, that can be higher education, but they don't want you focused just in medical education. So that's my disclaimer as to why I'm calling it health profession. And also, what applies in one field likely applies in another. Nursing has been doing education research much longer than medical. They have nurses in the hospital 24/7, just like doctors are. Yeah, their scope of practice is a little different, but a lot of the education barriers are the same. So they may have papers that give you ideas that you can then apply to your work. So don't ever exclude that. I still have nothing to disclose. So now we're going to, again, we're going to look at, again, Glassix criteria, and we're going to have you do some work as well, and I'll be providing additional examples. Here again is scholarship assess. So I think we kind of did this, but think about your learners and think about, again, a problem you have. You talked about the mentoring not working. Do you have problems where you think, I teach this and I teach it and I work at it so hard, I teach my heart out, and they just don't seem to get that? Does that ever happen to you? Do you wonder why they come to you when they're a second-year resident and they still can't do a history and physical to your satisfaction? Right, so anytime there are teaching problems, it actually creates work for you. So if problems can be solved earlier, it potentially makes your job easier. I used to teach in a college. I was teaching in higher ed in the sciences, and I front-loaded my courses. I would grade very hard for the first 3 weeks. And boy, I whipped those students into shape so well that by the end of the semester, when they were tired and I was tired, they could do the assignments, they knew the level of quality, and unless a student's grade was on the line, I didn't even have to grade some papers, because I focused and worked very hard with them in the beginning to get them to give them what I wanted. If you always know, right, it's great if they give you great product. Those aren't the problem people. So how can you help get the people to do your trainees to do what you want to do? That could mean that you have to work with the program and say, we need to add something in the first year, because by the time I get them in the second year, if you have time or interest, I have an idea. Don't go to somebody with a problem unless you're willing to help solve it. So you can think about that other ways. But if you can get trainees to do what you need them to be doing the way you need them to be doing, it makes your life 500% easier. So, who are your learners? Just think about that. I do faculty development. Who do you think my learners are? They're faculty. I don't work with medical students, but they're still learners. Right? So again, think broadly. Could they be your patients? Right? Patient education is huge too. So there could be another idea to think about. They're adults. Even if you have pediatrics, the adults, let's talk to the parents. They're adults, so the adult learning theory applies to your patients just like it does to your trainees. So, okay. Keep working on it. If you can keep working on the problem you were thinking of, think of another one. You know, it'd be nice if you walked out of here with 3 problem-sized questions, right? What a bang for your buck. Okay, so I'm going to move forward. We're not going to bring it to the front this time, but it's an idea for you to hold on to as we go through the other steps. So now maybe you have an anchor. If I say something about where to look for literature or methodology, you can say, oh, that would be great for my problem. So that's part of the reason I do this, is so that you can actually continue to add to this, even though we don't have an enormous amount of time to work something out. So you might, again, be able to walk home with something that you have to discuss and might be able to implement. So this question relates to not who do you teach, but who do you want to research? What would be your primary research audience on one question? How many of you are interested in doing some research that involves medical students? Okay, you can kind of look around, keep your hands up, look around the room. Okay, so if you were at a bigger meeting, more time at home, these are people you might want to go talk to, say, what do you want to do? Do you want to collaborate? Residents? Yeah, that's usual. Usually the same hands, because often they're in the same place, so the question may just apply to different learners. Fellows? Oh, sorry, you're in the wrong room. You'll have to look someplace else for a collaborator, but I'm sure other people in here have a second and third question. Colleagues? Yeah, the mentoring problem is a combination, right? So we have colleagues who we also want to study. Patients? Okay, great. So this is how you might find your collaborators, is based on who you want to study. It can be the question, but it can also be who you want to study, just starting to try to build your community. Often you're kind of isolated at home, and it's hard to find people. So again, remember, it's all about the literature. I cannot overemphasize how important this is. Once you start reading papers that bear fruit, make sure you sign up for the e-table of contents for that journal. Then you find the next one, then it's that journal, right? So you keep trying. So start naming some education journals, medical, higher health profession education.
Academic pediatrics.
Academic pediatrics, okay. Another one?
Academic medicine.
Academic medicine. Journal of Graduate Medical Education. Okay, so they're not exactly spouting out fast, but you know some of them, and if you worked on it, you'd probably find more. If one of these journals has papers that you read all the time, ask them and see if you can become a reviewer. I review for academic medicine. I have learned so much that adds to my research. Don't overdo it. They don't send them to you constantly. I maybe get 1 or 2 a year, and I try not to say no, but they actually help educate me tremendously, even though they're a lot of time. Particularly if it's a newer field, I'm constantly grabbing references. We did that. So here is a list, and this stuff will be posted. This is the AAMC has an annotated list of journals, and it's on their website, and the website's there. But again, this will be posted. You can always email me if I can send you the presentation. So this can be useful, and they all have information about what kind of journal, what kind of articles they take, what's the audience, things like that, to help you decide potentially what journal. On my campus, we did an activity where people actually had to go take their idea and look through those and say what journals would be suitable to publish their idea in. So then they narrowed down, they had an idea, where am I going with this? What's the plan? So you know you actually get there. So maybe as you do, you think about, maybe I should read the author instructions. Academic medicine, is anyone familiar with AM last page? The last page of every single issue is a 1-page, beautiful color schematic. It only has 2 or 3 references. A lot of them have to do with education. So they actually took all the ones, about a year ago, all the ones that have to do with education and put them into an ebook, and it's on their home page. And they lists like how to pose a question, the difference between qualitative and quantitative, all kinds of things, where to publish, ethics, and everything about education research, 1 page, in color, with a schematic. I love it. I use them in teaching a lot, and it jump starts me. So I highly recommend going to Academic Medicine homepage and looking for that. You can download it from there. If you email me, I can send you the link. It's too big to actually email the whole thing. Medical Teacher is this is an international journal. It's based in Europe. Harden is the major editor of this. They have lots of collections. Best BEME is the best education, some evidence in medical education guides, AMY guides. What else do they have? 12 tips. And some of these are very focused on doing education research. So there's one from 2014, Medical Education Scholarship and Introductory Guide. Again, you can go on to Medical Teacher web homepage and just search through their collections, and you'll get a whole list of them. And they're fabulous. They're a go-to for me. They're often literature I give for reading for classes related to health professions education research. So these are some quick resources to kind of get you started. MedEd portal is good. you have to have some scholarly approach more than having actual evidence. I think that they're now indexed in in PubMed. They didn't used to be, but they are trying to up the ante for them. They do predominantly curriculum activities, things like that. Education research is messy. Just get over it. You can't have easy controls. You may not have a huge N. Your statistics may be funky. Get that statistician in early. How do I deal with an N of 20? What do I do with this data? They can help you with that. So this is just get over it. The learner has got 50 million problems and you've got 50 of them in your class, right? So again, you can't isolate it that way. The material is complex. The teachers are complex. They're not the same person all the time. The environment, the institution, the culture. So sometimes things that are published in one area, you would say, well, that's really not innovative. Somebody's already published it. But they're at Harvard. And they have all these resources, and they have this beautiful model world, which I'm told they really don't, but I like to think that. But I'm at little Oklahoma, and we're pitifully poor, and it was getting worse. So how do I solve the problem at my institution? My solution may be totally different, and that is of value. So again, just like in clinical work, often you start with a case study, then you move up to an N of 10, then it gets bigger and bigger. The same can be true for education. You can have education case studies, but you often need to know different populations. And those are all valid. They can be valid. Make sure you make your case correctly for that. So it still could be relevant even though there's some literature on it. Your situation may be different. I'm not going to belabor this slide, and this will come with time. But theory drives education research. I've been in this area for maybe a decade. I was trained as a basic scientist. I'm still having problems with this. But it can help. I just read constantly they say self-determination approach to blah problem. So you just start reading it, or you hook up with an educational researcher who's got a real hang of this. It's my goal to get one paper out before I retire where I say a theory-driven approach to something. I have the theories and I use them. I don't know how to write about it. So, but look at those papers that have to do with theory. Don't gloss over them. 12 tips, medical teacher has them in 12 tips. They'll have a particular theory applied to. Academic medicine, last page, has Kolb's learning cycle applied to residency training. So they're out there in digestible ways applied to medical education, but this is something you really need to think about. Academic medicine also has, and I think it's on the same place as the AM last page guide for health profession education research, another ebook that has all of their review criteria. You can download it for free. I bought a copy because I use it so much. I would look at that because they talk about your theory-driven, what is the contextual framework for your research, and as reviewers we're asked to analyze and talk about that. So that little guide is also very useful, not just for you reviewing, but if you're writing, and not just for academic. It's nice, it's a nice publication. Appropriate methods. So here's my real fly-through. It can be qualitative, it can be quantitative. So what are the parameters of quantitative research? Numbers, right? We're all trained as quantitative researchers. We love quantitative researchers. We're very comfortable with that. And it's usually we're seeking an approach. We want to do precise measurement to answer the question that we're after. So we already have the hypothesis. This can be hypothesis driven. It still may not be because of experimental design, but numbers will be answering our question. We know what the variables are. They're very clearly understood. And you define them ahead of time as the researcher. Qualitative is not, this would be considered deductive. Qualitative is typically inductive. You don't know what the answer is. You ask people questions, you get their written comments, and you read them. What are the barriers and facilitators? You don't know. You see some things, but you don't know until you ask. And then you come up with, oh, it looks like this. Now that might be a hypothesis that you can turn and create a survey and collect now numerical or quantitative data. But you couldn't create a good survey until you had qualitative data to actually guide what that hypothesis might be. So they're different. And we think differently. I think most of you in this audience are like, qualitative makes me... It's fun, it's hard work, and it's different. That's all I can say. Get an expert to help you with it. So basic quantitative design would be, so X is the intervention, O is the observation. This is not a be-all and end-all, but a post-test only, where you have an intervention and you take a final exam. So I'm going to change this course up. I'm going to look at the ITE. I'm going to look at their final exam. Most journals won't even publish this anymore. This is so low level. There's no controls. There's no baseline. You're not building on anything. Pre-test, post-test is a little bit more rigorous. So you do a baseline, and you say, this is where they are here. I changed something, and this is where they are now. That's better. I mean, if you do clinical research, this is no different from any of that. You can have a crossover design, so they can act as their own controls. They act as their own controls. So maybe you want to do case-based in a lecture format. So with the same lecture group, you do case-based between, either you divide them up or you just do different sections of the course. Between test 1 and 2, you do some cases, and you look at the difference in test scores. Between test 3 and 4, you don't do cases. We did something at my residency where they looked at assist dogs to help with mental outlook and mental health with the residents. And so what we did was we put the dogs in with different teams on different weeks, and then we did assessments of their mental attitudes and things like that. So they acted as their own control. So again, this is where you talk to the statistician, not me. I'm just putting it out there. If it's no control group, it's not a hypothesis, and you cannot say something X causes Y. Just be careful of that. You can say it correlates, but without a control group, you cannot claim causation. Very important. So that's it for qualitative. That's really basic. That's pretty standard what people say, I'll do a pre-test or a post-test. Just be aware of what that gets you or doesn't. You're exactly right. And that's why it's not considered a very high level. Now, I will say, and so here's an example. Self-directed learning is now an LCME accreditation, a standard. So a lot of my faculty are saying, oh, I get put in a self-directed learning thing. It meets the criteria, and they all do a great job. So in another class, a buddy and I gave them a survey. Basically said, how did you approach this? How difficult was it? And about a third of the class said, this was pretty hard. I didn't know what I was doing. I had to practice. I had to go talk to a librarian. If we had just looked at the end scores, we would have said, why the heck is LCME requiring this? But because we added a survey, it's not really we did a thematic analysis. It's not qualitative just because it was not a grounded study. It wasn't that in-depth. But we learned something by asking, you're right. So you do have to be careful with what your question is and what your answer is. You could compare it. So some people might say, I've taught the course this way and this was the standard score. And then the next year you do it this way. And that changes. That's kind of like why I like the crossover where they act as their own control, if you can set that up. I kind of like that study design. But I would talk to a statistician. I gave you, 3? There must be at least 20 different ones out there. So there's a lot of different ways to manipulate with that. So we do have a couple minutes here. I want you to talk about methodology for the question you've been talking about. This gets harder now. Talk to your neighbor a little bit. What methods might you use? Okay, so how many of you are thinking qualitative? Okay. How many of you might be thinking quantitative? So there is something out there called mixed methods where you use a combination of qualitative and quantitative. Just putting that out there. So you can do both. And the other thing you should think about is in educational research, we often talk about triangulation. And that exists in basic science research. We just never called it that. We just called it having enough evidence. But triangulation means you look at the same problem maybe using 3 different types of methodology, and it all points to the same answer. So I used to do genetic research. Maybe I looked to see if messenger RNA was produced. Maybe I looked at what tissue was produced in, and then maybe I looked at the protein in the tissue to see if the protein was actually produced. And then that might maybe be a strong enough paper for publication, right? So you've already thought about triangulation, you just never gave it that word. I would encourage you to think that way in education research. When you do your lit search, look up methodology too. How do you do qualitative research? If someone's doing a paper, I try to model papers that are similar to what do I want to do. What method did they use? Imitate, mimic. That's how we learn, that's how we do it. There's nothing wrong with that. You don't have to solve the problems tomorrow, and if you try to, you probably won't succeed. So go with imitating, modeling, using what other people are doing and adapting it to your work. We did this before. Remember to always keep coming back and refining your question. So effective presentation, here's the publication that I talked to you about before, the Academic Medicine Review Criteria for Manuscript. I just beat myself to this slide, so it's on here. And that is a good reference to look at. So reflective critique, ask your colleagues to help. Can you present a journal club? Can you go to another section and present? Can you present on campus somewhere? Can you go to another department? Look on campus, where are all the places on campus that someone might be willing to hear? I've gone over, I'm in Peds, Family Medicine has a research group once a month. They're thrilled to have me come talk, and boy, are they thrilled to tear me apart. And it's fabulous. We have great discussions. They think totally differently than I do. And I learned so much, and it helps my project. So look, and they're looking at it, they do a lot of clinical research, and even though mine's education, they're looking at it from a relatively clinical population-based. If I present to our health professions group, research group, they're looking at it from a more education perspective, which is fabulous. I'm getting all kinds of perspectives. Get a poster, present your work or a piece of it here before you take it, just like any other work. Talk, 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 get your colleagues involved. Colleagues love doing that, you know, right? We love to talk, and well, you could do this, as long as I don't have to do it, it's fine, but you could do it. So what's your next step? Think about it. When you go home, you say, I went to this talk, it was kind of cool, it wasn't so cool, but you gave me a couple ideas, maybe I'll do something. What's the first thing you're going to do? Just think about that. I'm not going to ask you to raise your hands or anything, but you should think, again, what is your next step? Here are some medical education resources. Many of them in the journals I talked about. So again, think of it as problems. All research comes from a problem, something that needs to be solved. I always think about how can I make my life easier, because there's always going to be something else. Look for opportunities in new accreditation rules. That'll give you something to go on. And you know it's going to be novel, and you know your people are going to be interested. Use a systematic approach. Train your colleagues to keep forcing you back to that. And again, work on familiarizing yourself with the education literature, because it's invaluable to help you if that's where you want to be publishing. Okay, so I'm done.